literacy, and family engagement for infants and young children. This year, in the spirit of being culturally responsive ourselves, we added 2 more tracks, leadership and school transition. We couldn't do what we do without committed partners such as United Way of Greater Atlanta, who generously partnered with us to host this event for the 2nd year. Please welcome Ellyn Cochran, Associate Vice President, Early Learning and Development for Partner Greetings. Good morning, Ellyn.
Good morning, Bisa. Good morning, everyone. I want to thank you for having me here this morning. We are so excited and happy to partner with BCDI-Atlanta for this year's summit. At the United Way, we're committed to the success and well-being of children and families in Greater Atlanta. But we know that in order for this to occur, we must align our efforts to not just create access to high quality early learning opportunities, but we must address the systemic barriers and cultural intolerance and inequities that get in the way of their success. Since the onset of COVID and in partnership with the Community Foundation of Greater Atlanta and other funders, we have raised over $20 million and awarded funds to 320 organizations in 23 counties to provide emergency assistance and support the nutritional, educational, health, technology, and critical needs of children and families. Through our Racial Equity and Healing Fund, we are working to address racial and cultural disparities affecting child well-being. And I invite you to join our 21-day equity challenge, which you can find on the United Way website right now. The 21-day equity challenge is a powerful opportunity to develop a deeper understanding of how inequity and racism affect all our lives in Greater Atlanta and communities around the country. Today, I'm here at the request of the United Way and to bring greeting from Milton Little and from our leadership team. But I also just want to thank our co-funders from the Joseph B. Whitehead Foundation and all the great United Way partners and staff you're going to see today and tomorrow during the conference. Thank you for all you're doing to think differently about how we serve children in our communities and across the state.
Thank you, Ellyn. I truly appreciate you being a sincere advocate and cheerleader for the work we do at BCDI Atlanta. Established in 1981, BCDI Atlanta is one of 27 affiliates of the National Black Child Development Institute in BCDI. We engage leaders, policymakers, professionals, and parents on critical and timely issues directly impacting Black children ages 0 to 8 and their families. We coordinate community programs and initiatives throughout the state, supporting 6 focus areas: public policy, early care and education, health and wellness, family engagement, literacy, and child welfare. As we celebrate our 40th anniversary this year, it's important to reflect on our elders and the foundation of our organization. Please welcome Debbie Hillman, historian on BCDI Atlanta's Board of Directors, to celebrate our legacy. Welcome, Debbie.
Thank you, Bisa. Celebrating our legacy, a conversation with the elders. Please take a stroll with me this morning. The year was 1981. The city was Atlanta. Black children were crying out. Governor George Busby proposed quality-based education. Our Black scholars were concerned about that, and the children were crying. What did that mean? Black communities were reeling from the horrors of the Atlanta child murders. Children were scared. Parents were scared for them. Head Start was the loan-funded preschool program. And at that time, most of our children depended on Head Start. But guess what? There weren't enough slots to go around. There was no Georgia pre-K, and there were not enough slots, as I said, to meet the demands. Developmentally appropriate practices were rolling out, but guess what? Our scholars were concerned about whether or not they were culturally competent. guess what? A small, powerful group of Black scholars heard the cries of the children. And an important conversation in our history began. Because guess what? We just weren't sure that our children, the Black children, were getting what they needed. So imagine with me that either these individuals, the small group of founders, were either walking across the campuses of the Atlanta University Center, or sitting around a conference room, or sitting in someone's living room. Either way, one of the things that founding president Nancy Boxell, the Evelyns, Chisholm and Carol, the men, Asa Hilliard and Jim Young, and Gloria Elder, who happened to be the lone student in the area. These esteemed panelists, these esteemed scholars, these esteemed individuals came together and founded BCDI Atlanta as we know it now today. We're not sure what they were looking at, but they looked around. And as they looked around, they found an organization founded just 11 years earlier by Mrs. Ellyn K. Moore, who was concerned on the heels of the civil rights era that our children needed us. Black families were trying to figure out how to raise healthy children. They were doing it in the midst of social and economic concerns. There were health concerns. And so, guess what? They decided, okay, that's the model that we want to follow. In the coming months, we invite you to tune in to conversations that we will be having that will help everyone understand how BCDI Atlanta unfolded. We've only just begun, but the work is real and so are we. We're up for the task. Thank you.
Thank you, Debbie. As a member of BCDI Atlanta since 1996, you guys, we appreciate all the capacities you, Debbie, have served and continue to serve in our organization. You are a treasure. So the National Center for Cultural Responsive Educational Systems defines cultural responsiveness as the ability to learn from and relate respectfully with people of your own culture, as well as those from other cultures. So we're here today to learn effective strategies for doing just that. We chose the theme, lifting every voice, to open dialogue among parents and adults from different backgrounds, diverse backgrounds and cultures on best practices for meeting the needs of young children and their parents. While our organization focuses on Black children and their families, we respect, appreciate, value, and consider the needs of all children and their families. This summit enables us to rip off the bandages of racism, inequity, injustice, to confront the elephants in the home, the classroom, the break room, and the boardroom. We simply want to come together to come to terms with best practices for being and working together on behalf of the needs of young children and families. So we're so excited you guys have joined us. We're excited for our partners. We're excited for everyone who is here because we know that you want to learn about cultural responsiveness. Please welcome Pamela Ross and Tani Weatherspoon from United Way of Greater Atlanta to lead us in an interactive chat. Good morning, Pam and Tani. Take it away.
Good morning. Good morning, everyone. Hi, my name is Tani Weatherspoon from United Way of Greater Atlanta.
And I'm Pamela Ross from United Way of Greater Atlanta.
And we want to thank you for joining us today. And we're so excited that you're here. And one of the things that we'd like to do today is we want to hear everyone's voice. But unfortunately, if we unmuted you, we wouldn't hear anyone's voice. So what we're going to do instead is we're going to use the chat. So what I'd like for you to do this morning, I want you to get ready, get your little fingers ready. We're going to get on our keyboards, and I need for you to blow the chat up. We want to hear from you. Why are you here? Why is cultural responsiveness important to you? All right, so we're going to give you just a couple of minutes to share your thoughts with us. Again, we want you to blow it up. We want to hear what you're thinking. And Pamela and I, we're going to comb through the chat and hear what you have to say this morning. All right, ready?
We got some chats coming in.
Oh, here we go. Oh, already?
Yep. We have one. It heals communities.
Heals communities.
Mm-hmm.
Absolutely.
Someone said that they're just glad to be here. Oh, cultural equity determines how successful you are. We have lots of chats coming in. They're blowing it up, Tiny.
Oh my God. I might need to change my glasses to read this.
It's important to ensure it's my responsibility to do as much as possible to make change in my community for our future babies, to improve equity in our students' education. It gives everyone a voice. We have cultural responsiveness, so important because the lack of it harmed many of us when we needed to heal and go forward as a nation, healing the community. We have lots of healing going on in the chat.
Lots of healing, lots of equity.
Lots of equity. It lets our voices be heard and unites us all. Blowing it up, we keep it going. It gives back to our community. I want to make sure our brown babies are educated. It will make us all aware of cultures. It's important that we all treated equally, and children know that they matter. You want to take some? You want to take some?
I mean, I don't know if I could read that fast. I'm here.
That's all right. It lets our families know we're supporting them in our communities for the better of the future of all. It also helps everyone to know that we can benefit from each other. It helps us to see the best in each of us that before we did not think before. After our last administration, there is so much turmoil and diversity. We need to come together. A better me makes a better world for all of our children and all of us.
Oh, and there's
that one.
You see that shout out to BCDI in here.
Yes.
It's time, BCDI-Atlanta. All right, we got some fans in the chat box.
It promotes self-awareness and builds collective responsibility.
We see there's a lot of themes here about healing, equity, children and families. And we want to thank BCDI for leading this charge today. And we cannot wait to hear what your responses are after you get to join some of our sessions today. Keep blowing it up if you like. Well, it's continuing to blow up. So Dr. Bisa, it's on you now, Dr. Bisa. I don't know what to do with the chat.
Better future.
Thank you, Pam and Tani. Oh my gosh, that was amazing, guys. I was with you, Tani, trying to read quickly. Great comments, guys. Amazing. So we're happy you're here. So thank you to all the participants who joined us today. For whatever reason you decided to join us, it is our hope that you leave with new insights on how to implement and champion diversity, equity, and inclusion. One way to champion social injustice is to register to vote and exercise that right. The most recent election in Georgia was documented as having the highest voter turnout in its history. So BCDI-Atlanta was in the mix. As a nonpartisan organization, our goal was just to make sure that people knew how to register and that they knew where to vote and that they got out to vote. So we were actively engaging childcare programs in elementary schools in communities around the state in voter registration and participation. In an effort to better document and quantify our civic engagement efforts moving forward, we recently partnered with Vot-ER. You heard me right, Vot-ER. So please welcome the founder and executive director of Vot-ER, emergency medicine physician, Dr. Alister Martin. Good morning, Alister.
Good morning, Dr. Bisa. Thank you so much for inviting me, and I'm so happy and grateful to be with you all sharing power and sharing this space with you all this morning. Now, I'm an emergency physician, and you might think to yourself, that's sort of odd. Why is it a physician interested in voting and interested in helping to get out the vote? Let me tell you a quick story. I was taking care of a patient about 3 years ago now on a Friday night. It's 2 a.m. in the morning, one of these cold Boston winter nights, 2 degrees outside. And this young woman came in. She must have been in her mid-20s with her 2 children. And she said to me, "Doctor, look, I had to come to Boston about 2 or 3 months ago to escape a situation that wasn't healthy for me or the kids. And I came and moved in with an aunt of mine. And over the course of the last 2 days, we got into it and she kicked me and the kids out. Her 2 young, beautiful brown babies and her were sleeping in the van that they came to Boston in. She said, 'Can you help me?' Now, this is not a story that is uncommon in the emergency room. We take care of everybody. And we take care of folks when they're at their lowest. I called social work because quite often social workers really are the saviors when folks come in with social emergencies. And I said, look, we've got this woman here. She's here with her children, and I would love to figure out where we can get her housed for the next couple of days. There's no way I'm sending her out back to her van outside. Social worker said, okay, well, look, Massachusetts has some programs, but she's going to have to show that she has Massachusetts state residence. So can you go back and see if she has Mass residency? And if she does, we can get her into some transitional housing. So I go back to the patient and said, look, we're going to definitely help you. But do you have a phone bill or utility bill or a check stub that says that you're a Massachusetts resident? She said, no, doctor, as I told you, I just came to this state to flee a situation in another state. So I went back to the social worker. I said, you know what? She doesn't have anything. She doesn't have a proof of residence here in Massachusetts. What can we do? The social worker said, okay, well, there's one thing that we can do. We can register her to vote. Her voter registration would count as proof of residence in the state of Massachusetts. So I went back and I talked to the patient. I said, look, we're going to help you, but I got a sort of an odd question for you. Do you want to get registered to vote? What she said to me will stay with me forever. I didn't know I could. No one has ever asked me that before. I began to think at that point, man, how many of my patients are like her, feeling like they are on the outskirts of our democratic process, feeling like they don't have a seat at the table, feeling like they don't have a voice to help make the changes in public and health policy. And then I started looking and I found out we have 50 million people in this country who are not registered to vote. And quite often, they're the same exact groups that are most marginalized by our healthcare system: young folks, poor folks, and people like us, people of color. And so I began on a mission then to figure out how we can help folks while they're in healthcare settings, while they're in places like the incredible agencies and settings that BCDI works in. How can we help folks right then and there get registered to vote so they can take their power back, so that we can create policies, procedures, initiatives that help to enrich and empower everyone, but in the case of this incredibly important, our Black and brown babies, and to give them the head start that they need to accomplish their wildest dreams. So I'm so happy to partner with BCDI and the organization Vot-ER is an incredible, powerful sponsor of BCDI. And we have one ask for you, and that is to make sure that you are registered to vote. So take 30 seconds, send that text message right there, vote BCDI, to that number 34444, or use that QR code right there. Why? Because every year is an election year, and y'all got a big mayor's race coming up. So make sure that you have an opportunity to make your voice heard. Thank you so much.
Thank you so much, Dr. Martin and the Vot-ER team. Miho here in Atlanta, Rose, Aaliyah, thank you, all of you on the Vot-ER team for partnering with us to increase voter engagement in Georgia. We're excited to implement our Vot-ER partnership in one of our newer programs, Atlanta Choose Healthy Life, where we're working with 10 Black churches to support COVID-19 testing, give awareness on vaccination, offer awareness, and also education. So more to come on that. All of you guys will be added to our mailing list if you weren't before, so you will get a chance to learn more about our upcoming initiatives where you can go and get your COVID-19 testing. And while you're there, there have badges, the physicians and the volunteers, where you can scan or you can put in the text message or just go to the website to register to vote. So again, thank you, Vot-ER. So here is our agenda for today. You all have opportunities to participate in 3 rounds of concurrent sessions and choose from any of the 4 tracks. You can mix or match. You don't have to stick with one track. So if you haven't already looked on Schedule, check your email. It comes from SCHED. You're here, so I'm assuming you have it. You can always go back to Schedule. Someone from our team will place a Schedule link in the chat, so you can start choosing where you want to go for the next session. We'll have lunch at noon. So following your session, your session host and your presenter will allow you to leave for lunch, dismiss you for lunch from noon to 12:45, but make sure you return for an electric performance from celebrity music artist Ken Ford. We call him the King of Strings, that's how he's known. So followed by Ken Ford would be an unforgettable keynote address from Dr. Trelonda Triplett. Her keynote, guys, is entitled, check this out, Closed Eyes Cannot See. Whew. I cannot wait. And followed by her keynote, one of the sessions will be a follow-up Q&A in case you want more, and I know you will. So please tweet, post, and share with us using our handles at BCDI-ATL and at United Way ATL. On Twitter, I believe they're, on Instagram, I believe they're United Way Atlanta. And also use hashtags BCDI-ATL Summit and BCDI-ATL 40, celebrating our 40th anniversary, so that we can find each other. Those hashtags categorize your tweets and posts, and we want to find all those posts that you guys are sharing. So make sure you're sharing with us. Now it's time for our first round of sessions. So look at the choices there, click on the link in the chat to access your session of choice, and we'll see you back here in the main room promptly at 10:30 a.m. Enjoy.